Here to face off are Democratic strategist David Goodfriend and Republican strategist Matt Mackowiak. Matt, let's start with you. If somebody does believe that President Obama's policies are like Adolf Hitler, Barney Frank is right when he says you can't argue with somebody because they are like having an argument with a dining room table, right?
Come on, David. No one out there believes that references to the Nazis are appropriate. So anyone on any side.
Well, that woman did.
Well, look, I mean, I'm not going to sit here and respond to what one woman said at one town hall meeting. I think more broadly speaking, the question is, is the White House prepared to go it alone on health care? And the problem is that they're having problems with their own party. The Blue Dogs in the House appear to not support the public option, and they're hearing it in town halls across the country. There is not the support in the Senate, as Senator Kent Conrad said over the weekend, for a public option in the Senate. So there's still a lot of hurdles here. Even if the White House does decide to go it alone, there is absolutely no certainty that they're going to get a bill this year based on where things stand right now.
David Goodfriend, on that point, you see Rahm Emanuel talking about possibly going it alone because the Republicans don't want to offer anything, and then a few hours later there's Robert Gibbs saying, oh no, we don't even have a backup plan right now to go it alone. We're still focused on bipartisanship. Isn't that a problem when the Democratic Party, just in terms of their strategic message, can't get the same message out to progressives who are looking for some guidance?
No. The differences between the Democrats are much more narrow than that. It's a question of strategy and tactics and actually getting to a commonly held goal. But, you know, I think the Democratic President, Harry Truman, put it best when he said any jackass can tear down a barn, but a skillful farmer is what it takes to actually build one. The Republicans are just trying to tear down a barn here, and the American people smell it. What they're doing, the Republican Party, is they're marginalizing themselves. Whether or not they're actually going to be a part of this deal becomes a political liability to them. Don't forget, it was Bill Clinton, without a single Republican vote in Congress, who got his economic package passed, and suddenly the Democratic Party, for the first time in a generation, was more trusted by Americans with the economy. That's what's going to happen here. The Republicans are sidelining themselves. They're naysayers. They just say no, and they're not part of the solution. We're going to get a bill passed. Just look at the budget reconciliation procedure that was put in place earlier this year. The Democrats can get this out of the Senate with 51 votes. Don't forget that. And what that means is we can do it without the Republicans. We will do it without the Republicans if we have to. And the Republicans can explain to the American people why they thought that today's health care system was just fine and they didn't have to do anything to help fix it.
Matt, does David have a point? Are the Republicans sidelining themselves? We had a Republican strategist the other day who talked about, hey, at this point, leave it to the Democrats. The Republicans can just be the bystanders. Well, what elected official wants to be a bystander? This is the most important issue out there right now. We want people from all sides in talking about it.
Well, look, bottom line, Monica, is no Republican is happy with the healthcare system that we have and thinks it cannot be improved. The problem, David, that you need to consider is look at the NBC News Wall Street Journal poll that was released yesterday. Only 36% of the people that were polled yesterday said, over the last few days, said they thought that Obama's plan was a good idea, and only 24%, less than 1 in 4, said it was going to improve care. In fact, 54% think the bill goes too far. The problem is not with Republicans in Congress. The problem is with the majority of the American people that have deep concerns and reasonable questions about the plan that we have in Congress right now. And look,
Matt, though, with all due respect to the NBC poll, a lot of people would argue that the problem is with the polling and the question. I want to put up, here's element number 2. This is the issue of the public option, which a lot of Republicans have justifiably said, oh, this just proves that the American public does not want the public option, because only 43% said they did. But in the NBC poll, it wasn't given as a choice. Yet in these other polls, the New York Times CBS poll, when the public option is described as a choice along with private insurance, the number goes up to 66%, 62% for Quinnipiac, 56% for Time. The Washington Post ABC News poll, 54%.
Well, at the end of the day, the question that remains is, can a politician support whatever health care bill gets through Congress and win re-election? That is what individual members of Congress are worried about. And they've been home for the last 3 weeks in August in their congressional districts. Some Democrats are so scared they're not even holding public town hall meetings. They're doing it over the phone or mailing it in. So the real question is, are they going to support a health care bill? Right now there is deep concern. And look, there is not 218 votes in the House, and there is not 60 votes in the Senate.
You're leaving out a key fact, Matt. 60% of the American people think that our current current health care system is broken and must be fixed. You offer no answers. Your party is bereft of any answers. We're offering some proposals. One of them is going to pass, Matt. It might not be exactly the one that came out of the Senate Help Committee. It may not be exactly what came out of the House Ways and Means Committee. We got multiple committees of Congress that have reported out bills. There will be a vehicle passed out of this Congress, put in front of the president for his signature, and I hope, for your sake, that you guys have played a productive role, because if you haven't, we're going to eat you for lunch in the midterms.
David Goodfriend and Matt Mackowiak, I'm going to have the last word here by pulling up element number 3, and I'll leave open the idea that both parties have a way to fix this. But take a look at this map. It talks about insurance companies in 9 states. 9 states, including Senator Grassley's Iowa. There is one big insurance company that covers 70% or more of the entire population. In 17 more states, it's 50% or more. So when people say, oh no, the government's going to take away choice and competition, right now, in a lot of states, including Iowa, there is no choice for competition.
In the top 40 metropolitan areas in the country, they each have at least 8 private insurance companies that are operating in the top 40 metropolitan areas in the country. There's enough competition across the country.
Right, but in those same metropolitan areas that Matt, people express all over the country, they like Medicare more than they like their private insurance companies, and Medicare is government run. In any case, Matt and David, we appreciate you both coming on today. And